in 2025, we passed this beautiful thing that everyone likes to talk about, the one big, beautiful bill.
Yeah.
So if people aren't paying attention to healthcare policy, they may have heard of it, but they don't really understand it.
Yeah.
Could you kind of give us a little insight into what that really evolved? Because it's the biggest federal investment that we've had in decades.
Yeah.
So what does that really look like, or what does that mean right now when they're saying we have this big, beautiful bill? What is that?
And did you know that the one big, beautiful bill is a nickname?
Mm-hmm. I sure did.
You did?
Yes.
So,
but that's how everyone refers to it.
And that's the commonly understood name.
Absolutely.
But the actual legislation was the Working Families Tax Cut Act of 2025.
Yep.
But because it was so large and so encompassing, it earned the moniker of one big beautiful bill, but it's the Working Families Tax Cut Act.
Yeah.
And because of that, historically, and I'm not going to get into the politics of the whole thing, and because this isn't the time or the place. But the reality is, it's about the strategy around how funding was calculated and budgeted for, especially around Medicaid. Mm-hmm. And, given the economic dynamics of the country at the time and budgets, historically Congress had funded Medicaid year over year at about a 5% increase.
Okay.
Well, actuarially and from a policy perspective, Congress made the decision to dial that back to 2.5%.
Okay.
So naturally, that would mean reduced funding for Medicaid because, in theory, there would be a reduced need for Medicaid in the states.
Okay.
But that caused a divide. Mm-hmm. That caused challenges, especially in rural America, that rely on Medicaid funding for sustainability.
Yeah,
hence, a group of folks in Congress got together and came up with this concept to try to offset some of those reductions.
Yeah.
Hence, we got what we now know as a $50 billion appropriation called the Rural Health Transformation Fund to go directly to the states, 5 years, $10 billion per year, allocated not on a per capita basis, but similar.
Yeah.
But because there are rural states, smaller populations that got as much money as a large state like Texas.
Yeah.
With a large population. So there is a difference on a per capita basis, but that's how it came to be.
So when we're looking at the by state kind of difference of that, how did the states kind of come up with what they're looking for? Like, what did that process and planning look like? Because you can't just get a load of money for nothing. How did they put some initiative or strategy around those?
Yeah, that's been fun. I've had the really, really good fortune of engaging with many states directly, and if you look at Avel as a company, we're based here in the upper Midwest, but we support hospitals, health systems, governments in 46 states today, from the state of Washington, California, all the way down to Texas, all the way up to New Hampshire, Vermont, and Maine, and all across. So there's really, we've got such a huge footprint. But if you focus on our core, it's that 21, 22 states right down the middle of the country where, historically we have been so strong. And so, in short, to answer your question, it depends. But, there have been some states that have taken a centralized look at this, a centralized approach, led by a governor, led by the governor's office, and then deployed it out. Other states, they've taken a more by committee approach, organizing advisory committees of stakeholders in that state to help shape the plan. And so, it's just been a wide variety of strategy
Yeah.
that the states have gone through. And, some states, really their hospital association or organization of hospitals has had a significant role in
Absolutely,
building
yeah.
that plan. So it just depends. There's, some states are totally hospital based. There are some states that are more balanced. There are some states that are more structured, less structured. Again,
It all
if we
depends.
deal with one state, we deal with one state.
Absolutely. So
Yeah.
when we're thinking of when they came out with rural health transformation, what was their original goal with that? I know we talked about, it came from the one big, beautiful bill, but now what is their true goal? What are they trying to shape here?
Well, and I'm just going to use the vernacular of the day, make America healthy again and make rural America healthy again. And that's really a lot of the emphasis of improving healthcare outcomes for a part of the country that needed better access to care.
Yeah. And I think it goes into the challenges that we talked about a little bit before, access to care, looking at the workforce shortages and all of those other components as well.
Yeah.
Yeah.
As a company, I think we did like 41 or 42 state, we answered 41 or 42 requests for information.
Yep.
Which is
amazing.
Huge.
Yeah.
It's been a whirlwind. And going back, I should have qualified. This legislation was signed into law in July of last year.
Yeah.
And then a notice, really the notice of funding opportunity came out in September.
Yep.
And states were required to submit their original strategy, their verbiage in November.
Okay.
And it was limited. It can only be so many pages long, so many words. And so, this has just been a sprint over the last number of months to get us to this point where, budgets were finally approved by the Centers for Medicare and Medicaid Services just a few weeks ago. And so it's time to go.
Yeah.
Time to get to work.